It's 6:17 in the morning. Your alarm goes off. You open your eyes. You throw the blanket aside. You jump out of bed, and within seconds, your heart is under more stress than it has experienced all night. Now here's the shocking part. Millions of people do this every single morning, not realizing that the first few moments after waking up can be one of the most dangerous periods of the day for the cardiovascular system. In fact, cardiologists have known for years that heart attacks, strokes, and sudden cardiac events occur more frequently during the morning hours than at almost any other time of day. But why? And what could a simple 30-second habit possibly have to do with it? Part 1. The story that changed everything. A few years ago, a cardiologist shared a story that caught the attention of thousands of patients. One of his patients, a retired man in his late 60s, had a routine every morning. The alarm would ring. He would immediately jump out of bed, rush to the bathroom, start moving as quickly as possible. Then one morning, something unusual happened. As soon as he stood up, he felt dizzy, his vision blurred, his heart started racing. Within moments, he collapsed. Fortunately, he recovered. But during his medical evaluation, doctors discovered something important. His cardiovascular system was struggling to adjust to the sudden transition from lying down to standing up. The problem wasn't simply getting out of bed, it was how quickly he was doing it. Now, not everyone who jumps out of bed is at risk, but this story highlights a reality that many people never think about. Your body undergoes major changes while you sleep, and waking up is not as simple as flipping a switch. Part 2. The secret battle inside your body every morning. While you're asleep, your body enters a completely different state. Your heart slows down, your blood pressure drops, your breathing becomes more relaxed. Your nervous system shifts into recovery mode. Then morning arrives, and suddenly, everything changes. Hormones surge, blood pressure starts climbing, heart rate increases, blood vessels begin tightening. Your body is preparing you for action before your feet even touch the floor. What most people don't realize is that this transition places extra demands on the cardiovascular system. For a healthy heart, that's usually not a problem. But for someone with high blood pressure, diabetes, hidden artery disease, or even simple dehydration, those first few minutes after waking can become far more important than they appear. The secret battle inside your body every morning. But sometimes, the most important battles are the ones we never see. Let me tell you about someone I'll call Michael. Michael was 68 years old, a grandfather of 4, the kind of man who never missed a day of work during his entire career. He wasn't a smoker, he tried to eat reasonably well, and like many people his age, he believed that if something was seriously wrong with his heart, he would know it. After all, heart attacks are dramatic, right? Crushing chest pain, a person clutching their chest, an obvious emergency. At least that's what he thought. But for weeks, Michael had been noticing little things. Nothing alarming, just small changes. Some mornings he woke up feeling unusually tired. Not exhausted, just different. Occasionally, when he stood up quickly, he felt a brief wave of dizziness. A few seconds later, it would disappear. He blamed age. One morning, while walking to the kitchen, he noticed he was slightly short of breath. Again, nothing severe. He told himself he probably hadn't slept well. Days passed, then weeks. The signs remained subtle, easy to ignore, easy to explain away. Because that's what many of us do. We assume tomorrow will be exactly like today. We assume our bodies will keep doing what they've always done. And most of the time, they do. Until one morning, they don't. One Tuesday morning, Michael's alarm went off, just like every other day. He sat up quickly, stood immediately, and within moments he felt something wasn't right. Not severe pain, not the dramatic symptoms he'd seen in movies, just a strange pressure, a sudden weakness, an overwhelming feeling that something was wrong. His wife noticed the color leave his face. She called emergency services. At the hospital, doctors confirmed he was experiencing a heart attack. Fortunately, Michael survived. But later, during recovery, something his cardiologist said stayed with him. The doctor explained that the heart attack didn't begin that morning. The process had been developing silently for months, perhaps even years. The warning signs had been there, small, quiet, easy to dismiss. And that's what makes heart disease so dangerous. It often whispers before it screams. The body frequently sends signals long before a crisis occurs. Not always dramatic signals, not always obvious ones. Sometimes it's unusual fatigue, sometimes it's dizziness, sometimes it's breathlessness, sometimes it's simply a feeling that something has changed. And while not every symptom means something serious is happening, paying attention to those changes matters. Because every morning, as your body transitions from sleep to wakefulness, your heart is performing an incredible amount of work behind the scenes. Work that most of us never notice, until we're forced to. So as we continue, I want you to keep one question in mind. What if your body has been trying to tell you something, and you've been too busy to hear it? Because next, we're going to uncover the 30-second morning habit that cardiologists say may place unnecessary stress on your heart during this critical window of the day. Part 3. The 30-second mistake most people make. And that's where the mistake happens. It's so common that most people never question it. The alarm rings, you sit up, you immediately stand. Maybe you're rushing to work, maybe you need the bathroom. Maybe you've simply done it this way your entire life. But when you stand suddenly, gravity instantly pulls blood toward your legs. Your heart must react immediately. Your blood vessels must react immediately. Your blood pressure must adjust immediately. For some people, this process works perfectly. For others, it creates dizziness, lightheadedness, racing heartbeat, and unnecessary strain on the cardiovascular system. And that's why many heart specialists recommend something surprisingly simple, just a few seconds, before standing up. Part 4. Tease the rest of the video. In today's video, we're going to uncover why heart attacks occur more often in the morning, what actually happens inside your arteries during the first minutes after waking, the warning signs cardiologists say you should never ignore, 5 common morning habits that may be silently stressing your heart, and the simple heart-friendly morning routine that takes less than 2 minutes but could help your body transition more safely into the day. The final section may completely change the way you wake up tomorrow morning. So before you get out of bed again, make sure you watch until the end, because sometimes protecting your heart doesn't start with a medication, a diet, or a workout. Sometimes it starts with just 30 seconds. I want to share a story, not because it's dramatic, not because it's rare, but because it happens to ordinary people every single day. There was a woman named Sarah. She was 72 years old, a mother, a grandmother, the kind of person everyone in her family depended on. Every morning she followed the same routine. Wake up, make coffee, feed the dog, call her daughter. Nothing unusual. Nothing that would make anyone think her heart was in danger. In fact, if you had asked Sarah how she felt, she would have told you she was doing just fine. Sure, she was a little more tired than she used to be. Sure, she occasionally felt lightheaded when standing up, but she thought that was simply part of getting older. And that's the problem. Many warning signs don't feel like emergencies. They feel normal. They blend into everyday life. Until one day, they don't. One morning, Sarah woke up feeling slightly off. Not sick, not in pain, just different. A little weaker, a little more breathless than usual. She almost ignored it. In fact, she nearly went back to her regular routine. But something inside her told her to pay attention. Later that day, doctors discovered she had experienced a serious cardiac event. Thankfully, she survived. But during her recovery, she said something that her family never forgot. She said, "I wish I had listened to my body sooner." Not because the signs were dramatic, but because they were easy to dismiss, easy to explain away, easy to postpone. Stories like Sarah's remind us of something important. Heart problems don't always arrive with flashing warning lights. Sometimes they arrive quietly. A little fatigue, a little dizziness, a little shortness of breath, a subtle change that seems too small to matter. And that's why understanding what happens inside your body each morning is so important. Because knowledge doesn't create fear. Knowledge creates awareness. And awareness gives you the opportunity to act before a small problem becomes a serious one. As we continue through this video, I want you to think about your own mornings, your own routine, your own body. Have there been signs you've been brushing aside? Symptoms you've blamed on age, stress, or lack of sleep? Because the information you're about to hear could help you recognize what your heart may have been trying to tell you all along. And sometimes, that awareness can make all the difference. Section 1. Why heart attacks often happen in the morning. Most people assume heart attacks can happen randomly at any time, and they can. But doctors have noticed something interesting. Heart attacks tend to occur more frequently during the morning hours, particularly between 6 a.m. and noon. Why? The answer involves several natural biological processes. When you're sleeping, your body enters a state of relative rest. Your heart rate slows down. Blood pressure decreases. Your nervous system becomes calmer. But as morning approaches, your body starts preparing to wake up. Hormones begin rising. One of those hormones is cortisol, often called the wake-up hormone. At the same time, adrenaline levels increase. Your body is essentially preparing for action. These hormonal changes cause increased heart rate, higher blood pressure, greater oxygen demand, increased blood clotting tendency. For healthy individuals, this transition usually happens smoothly. But for someone with underlying cardiovascular disease, blocked arteries, or uncontrolled blood pressure, this period can place additional stress on the heart. Think of it like starting a car engine. A gentle warm-up is usually fine, but flooring the accelerator immediately after starting the engine can create unnecessary strain. The heart works similarly, and that's where the morning mistake comes in. Section 2. The 30-second mistake. So what is this common mistake? Jumping out of bed too quickly. It sounds harmless. In fact, many people do it every day without thinking. The alarm rings, you wake up, and within seconds you're standing upright. But your cardiovascular system may not be ready for such a sudden transition. When you lie down, gravity distributes blood relatively evenly throughout your body. The moment you stand up, gravity pulls blood toward your legs. Your body must instantly compensate. Blood vessels tighten, heart rate increases, blood pressure adjusts. For younger, healthy people, these adjustments happen quickly. But for older adults or individuals with heart disease, diabetes, dehydration, or blood pressure problems, the transition can be more difficult. This sudden change may trigger dizziness, lightheadedness, temporary drops in blood flow to the brain, increased cardiovascular strain. Some people even faint, others experience heart palpitations, and in high-risk individuals, sudden cardiovascular stress may contribute to serious events. Again, standing up isn't dangerous. The issue is standing up too quickly, especially first thing in the morning. Section 3. What happens inside your body? Let's look deeper at what happens physiologically. During sleep, blood pressure naturally drops. This is called nocturnal dipping. For many people, blood pressure may decrease by 10 to 20%. Then morning arrives. The body initiates what's known as the morning blood pressure surge. Blood pressure begins rising, heart rate increases, blood vessels constrict. The nervous system becomes more active. Now imagine adding a sudden movement on top of all that. The body must rapidly compensate. For some individuals, the system handles it perfectly. For others, it creates instability. Research has shown that sudden changes in blood pressure can be particularly problematic for people with coronary artery disease, heart failure, atrial fibrillation, diabetes, advanced age, high blood pressure. This doesn't mean every quick movement causes a heart attack, not at all. But it helps explain why cardiologists often encourage patients to wake up gradually. Small changes can sometimes reduce unnecessary strain. Section 4. The warning signs you should never ignore. Now let's discuss symptoms. Many people ignore warning signs because they assume they're tired, or getting older, or simply not awake yet. But certain symptoms deserve attention. These include dizziness upon standing. Occasional mild dizziness may happen, but frequent episodes should be discussed with a healthcare provider. Chest pressure. Any unexplained chest discomfort deserves evaluation, especially if it occurs repeatedly. Shortness of breath. Feeling unusually breathless after waking may indicate an underlying issue. Heart palpitations. An occasional skipped beat isn't always dangerous. Persistent or recurring palpitations warrant medical attention. Fainting episodes. Never ignore loss of consciousness. This requires professional evaluation. Extreme fatigue. If you're consistently waking exhausted despite adequate sleep, it may be worth investigating. Conditions such as sleep apnea can increase cardiovascular risk. The key message? Listen to your body. Symptoms are information, not inconveniences. Section 5. Other morning habits that may stress the heart. The 30-second mistake isn't the only habit worth discussing. Let's look at several others. Habit number 1. Checking stressful news immediately. The moment many people wake up, they grab their phone, emails, messages, bad news, work problems. Your stress response activates before you've even gotten out of bed. This can elevate blood pressure and heart rate. Habit number 2. Skipping water. After several hours of sleep, mild dehydration is common. Hydration supports healthy circulation. A glass of water in the morning may help replenish fluids lost overnight. Habit number 3. Smoking first thing. For smokers, the first cigarette of the day can cause rapid increases in heart rate and blood pressure. This places additional strain on the cardiovascular system. Habit number 4. Heavy emotional stress. Arguments, financial worries, work anxiety, all can trigger stress hormones. Chronic stress remains a significant factor in overall heart health. Habit number 5. Ignoring sleep quality. Poor sleep affects blood pressure, blood sugar, weight management, inflammation, Protecting sleep is protecting your heart. Section 6. The heart-friendly way to wake up. So what do cardiologists often recommend? A gradual wake-up process. Here's a simple routine. Step 1. Wake up slowly. When the alarm sounds, don't immediately leap out of bed. Give yourself a few moments. Step 2. Stretch gently. Move your arms, move your legs. Allow circulation to adjust. Step 3. Sit first. Before standing, sit on the edge of the bed. Remain there for about 20 to 30 seconds. Step 4. Take deep breaths. Slow breathing may help create a calmer transition. Step 5. Stand gradually. Rise slowly and steadily. Give your body time to adjust. Step 6. Drink water. Hydration supports normal physiological function. Step 7. Start the day calmly. Avoid immediately diving into stressful situations whenever possible. Simple, practical, and easy to implement. Section 7. Who should be especially careful? Certain groups may benefit most from gradual morning transitions. These include adults over 60, people with high blood pressure, individuals with diabetes, heart disease patients, people taking blood pressure medications, those with a history of dizziness or fainting. If this sounds like you, paying attention to how you wake up may be particularly valuable. Again, these suggestions are not substitutes for medical care, but they can become part of a heart-conscious lifestyle. When people think about protecting their hearts, they often focus on dramatic changes, intense workouts, strict diets, expensive supplements. But sometimes, the most meaningful habits are surprisingly simple. The way you wake up, the way you stand, the way you begin your day. That 30-second pause before getting out of bed may seem insignificant, yet it gives your cardiovascular system time to adapt, time to adjust, time to transition smoothly from rest to activity. Your heart works for you every second of every day, more than 100,000 beats, without taking a break. Treating it with care doesn't always require major changes. Sometimes it starts with slowing down for just a few moments each morning. If you found this video helpful, share it with someone you care about, because one small habit may help someone start tomorrow a little safer than today. Thank you for watching. Stay healthy, stay informed, and take good care of your heart.